NACCHO presents Aligning State and Local Strategic Plans to Increase Colorectal Cancer Screening. This screencast will demonstrate how local and state health departments can work together through strategic planning to support the 80% by 2018 initiative and increase colorectal cancer screening. You will learn about the National 80% by 2018 initiative, NACCHO's framework for local comprehensive cancer control, and local and state organizations in Iowa that work together to align their strategic plans to increase colorectal cancer screening in their community. Colorectal cancer is the third leading cause of cancer death in men and women in the U.S. and a cause of considerable suffering among more than 140,000 adults diagnosed each year. About 1 in 3 adults between ages 50 and 75, totaling 23 million people, are not getting tested as recommended. In response to this public health problem, the National Colorectal Cancer Roundtable established the 80% by 2018 initiative, through which dozens of organizations have committed to eliminating colorectal cancer and are working toward the shared goal of reaching 80% of adults age 50 and older screened for colorectal cancer by 2018. Local and state health departments have an opportunity to collaborate to increase colorectal cancer screening. This can be done by aligning the objectives focused on colorectal cancer screening in the strategic plans of the health departments and cancer control coalitions serving the same communities. NACCHO offers an online framework for local comprehensive cancer control to help state and local cancer prevention coalition partners develop and lead collaborative efforts to prevent cancer in their jurisdictions. One component of NACCHO's framework focuses on strategic planning. The strategic planning process benefits cancer control coalitions by formalizing a sense of purpose, providing direction, ensuring that coalition efforts are feasible and likely to make an impact, and providing a framework to determine if coalitions reach their desired goals. There are 4 tips to consider during the strategic planning process. First, map out a vision. Second, examine the data. Third, prioritize and focus. And fourth, integrate evidence. Start by mapping out a vision. Create a shared vision statement for your coalition membership to create unity among members and provide a blueprint for the coalition's direction. Next, collect or refer to assessment data to identify the issues that impact the cancer problem in your community. Use national and local data sources to develop both big picture and community level views about the causes of the colorectal cancer problem in the community. The State Health Department, Centers for Disease Control and Prevention, and the American Cancer Society are important stakeholders to consult if you are looking for support in gathering data. Sources of data to inform strategic planning efforts related to colorectal cancer include the Behavioral Risk Factor Surveillance System, the American Cancer Society's Cancer Facts and Figures, the State Cancer Plan, and state or national mortality and incidence data. Then, use your vision and assessment data to prioritize your coalition's goals and focus your activities. And finally, integrate evidence into the strategic plan. Identify and use evidence-based prevention strategies to increase the likelihood of successful impact through your coalition's activities. Consult resources like the Community Guide, a CDC-sponsored website that houses the collection of all Community Preventive Services Task Force findings on interventions that have been proven effective. For packaged interventions that align with Community Guide recommendations, visit the National Cancer Institute's Research Tested Intervention Programs site. Now you will learn how local and state organizations in Iowa work together to align their strategic plans to increase colorectal cancer screening in their community and support the 80% by 2018 initiative. The Iowa Comprehensive Cancer Control Consortium collaborated with the Iowa Department of Public Health to implement Iowa Gets Screened. The program grew out of a long history of partnership at the state level to promote cancer screenings with available funding and resources from the national, state, and local levels. In 2009 and 2010, Iowa Gets Screened started focusing on ways to engage local health departments in increasing colorectal cancer screening in partnership with healthcare providers and other key partners, including federally qualified health centers. Lynn County Public Health, a local health department, was a key partner in this venture as a member of the Iowa Cancer Consortium and was involved from the inception and development of the Iowa Cancer Plan. The Iowa Cancer Consortium worked closely with Linn County to align all facets of their work. The Iowa Cancer Consortium and the state-level Iowa Department of Health implemented strategic planning processes to consult behavioral risk factor surveillance system data, the state cancer plan, and evidence-based approaches to increase colorectal cancer screening. This level of collaboration resulted in the implementation of mutually reinforcing approaches to colorectal cancer screening across the entire state and within Linn County. The partnership between Linn County Public Health and the Iowa Cancer Consortium increased implementation of evidence-based strategies to promote colorectal cancer screenings, including promotion of colorectal cancer screenings with other recommended screenings. This partnership also supported Linn County in working with area physicians who educated the community as a means for increasing physician recommendations for colonoscopy, another evidence-based strategy for increasing CRC screening rates. The partnership with the Iowa Cancer Consortium enabled Linn County Health Department's local program to provide colorectal cancer screenings to 50 individuals each year. In the Cedar Rapids municipal area, colonoscopy and FIT were provided to more than 100 people each year. Engaging key regional partners in cancer control requires creativity by the leading organizations to identify opportunities to leverage funds, resources, and expertise to align efforts among partners. In summary, local and state health departments and their cancer control coalitions can work together to increase colorectal cancer screening by aligning objectives in their strategic plans. Using the 4 strategic planning tips, map out a vision, examine the data, prioritize and focus, and integrate the evidence, you can plan collective action and goals to support the 80% by 2018 initiative.